right, so we'll move on then to our 8:35 item. That's a COVID update. Kathy and Jamie and Becky is back again. Good morning. Is your microphone off, Kathy?
I'm sorry, it was off. I don't have my jump drive for my PowerPoint, so I'm not.
Okay, well, you're going to have to wing it.
I really sincerely apologize. I don't know if I dropped it on the way or if I forgot to grab it.
Well, we have a copy here.
Okay,
It's,
yeah,
unfortunately, the folks online will not.
Folks online won't get
You
it.
could
Sorry about
probably
that.
link it to your public health page, correct?
Yes.
Okay.
Okay. Well, we'll move forward with the update on the numbers. Now, I don't want you to get too excited. The numbers look really good, but there's a real delay because of Thanksgiving. So we have the holiday in here, and then, of course, Minnesota Department of Health doesn't do the weekend updates either. So we have a significant delay. So the number, 386 active cases is really what we would call not accurate, because there will be a catch-up this week. So we'll see them catch up following the Thanksgiving holiday. So there'll be more accurate numbers the end of this week and into next week. So
When you bring that, Kathy, next time, if you're going to bring it, will you compare those numbers to the 23rd, or those compared to the 22nd then?
correct, yes, that would be.
Because if we're seeing an inaccurate number for the 29th, we don't want to compare next week's to the 29th.
That's correct, yes. So we will have those numbers for a comparison. So unfortunately, we couldn't, we just can't get better numbers at this point. So, and then, of course, the state, the active cases in Minnesota are not accurate as well. So the 30,710, there will be some lagging data that will catch up this week. So the week before was 35,797. So it's really not a good comparison. Active cases in Cass County this week were 659. We don't know if they had much lag. I think their Department of Health maybe worked on Friday, so theirs might be a bit more accurate. And then the active cases in North Dakota are 2,517 for the whole state. So yeah, so they're looking like a little bit down. The active cases on the next page by age, so it's the age distribution of the cases. And again, we're seeing higher numbers in the adolescents, and we're also seeing an increase in the numbers of the 35 to 44 age group. The following slide is a cumulative cases by age for Clay County, and again, our total cases, 12,032. So we're seeing again across the age span, the variant ages that we're seeing the levels of the 20 to 24 still at the highest level of cumulative cases. And then the next slide is just the overview of the cases that we show every week. So from the beginning of the pandemic until current. And again, the last number will change as the data catches up. So we're seeing that, we did see kind of a peak. We're hoping it's a peak in the end of October, beginning of November. So we'll see as the data catches up next week where we're at as far as this peak for the fourth wave. And then I'll have Becky talk about the next slides.
Good morning. Before jumping into more data, I just wanted to bring up the new variant that was found. It's received a lot of media attention. I'm sure you all have heard something about it in the recent days. So what we do know is that it was discovered in South Africa. It was first reported to the World Health Organization on 11/24. They gave it the name of Omicron or Omicron. We've had a debate on how to pronounce that in our office, so either way. So And it is a little concerning because there had been a lull in cases in South Africa, followed by a recent surge over the past couple weeks, which led to the detection of this variant by genetic sequencing. So one concerning aspect is that the Delta variant had been the predominant strain circulating in South Africa, like it is here, and this variant quickly has taken over as the predominant variant. So just in a matter of weeks, compared to Delta that took a few months to take over as the predominant strain. The World Health Organization has classified it as a variant of concern, which is kind of a level 3 out of their level. There's 4 levels of different variants. So the first one is variants being monitored, variants of interest, variants of concern, and variants of high consequence. So this is an elevated concern at this point. We do have more questions than answers. So hopefully in the coming weeks, we'll know more about, the impact of this variant. Another concerning aspect is that there's a large number of mutations in the spike protein portion of this variant, much larger, or many more mutations than we saw with Delta. It has not been detected in the U.S. yet, but in all likelihood will be. The CDC surveillance team is actively monitoring for this, so likely within the coming days to weeks, I would anticipate that we'll find it here. And then just lastly, it's not surprising that this virus has mutated. It's expected, especially with RNA viruses. They're very error prone when they replicate, so this is not a huge surprise. What we don't know, which is a lot, unfortunately, is that, we don't know if this variant is able to escape antibodies that have been made, from people that have either had previous infection through antibodies that are made through vaccination. So that's all in the works. There's studies that are currently being done, and we should know within the next week or two if the vaccine will still be as effective as it was with previous variants. We also don't know if this variant is more contagious, more transmissible, or if it'll cause more severe disease. That's all, again, something that will come out as more time goes on. So good news in light of this, because this is disheartening, obviously. We're already suffering from pandemic fatigue. Booster vaccines can be modified relatively quickly if needed. If it winds up being that the booster or that the vaccines that are currently produced now need to be modified, that can be done. And work on that has already started. And even if we do see a decrease in the effectiveness of the vaccine, it's extremely unlikely that the variant would escape immune responses from the vaccine completely. So we will not be starting all over again.
How do they come up with that name? Sounds like a villain
I
out of
think
Star Wars.
or a transformer. Well, yeah, so the next Greek alphabet letter would have been Nu, and I think people were concerned, that it would be confused with Nu as in N-E-W as opposed to N-U, so I don't know for sure.
Yes. Commissioner Mojo has a question.
Thank you. I know in the past I've gone in for my flu shot in September, and sometimes by May there are new variants. And as we move to an understanding of what the endemic living with it is, how many variants do we typically see with the flu in a flu season? And only just to help us understand kind of, maybe that's a really high level answer with a low level question, I'm not sure.
Yes, that is a complicated question. I think typically we see 2 to 3 circulating strains of flu per year. It varies by the year. We don't yet know how often or how frequently the SARS-CoV-2 virus is going to mutate. That's still up in the air. What we do know is that we need to get more people vaccinated because this is just fueling that.
Right. Thank you.
Any other questions before I move on to data? All right, so the next slide is just the CDC level of community transmission that they update on a weekly basis. Nothing has changed from last week, so Clay County and all of Minnesota continue to be in that high level of transmission. The next slide is Clay County deaths per week. We did unfortunately have 2 more Clay County residents that have passed away since last week, so we're at a total of 104 deaths for the pandemic. And then the next slide is Clay County hospital admissions per week. So we did see quite a bit of uptick over the past several weeks. So we had 16 reported admissions 3 weeks ago, 13 the week before, and then just 5 so far reported last week. So hopeful that those admissions have actually gone down, but again, there's such a lag in the data. We'll see by the end of the week if that number is actually larger. And then hospital capacity in Fargo. So at the time of this report, Essentia had 1 staffed ICU bed for adults and 0 pediatric staffed ICU beds. Sanford had 5 adult ICU beds and 3 pediatric ICU beds available, and the VA had 2 adult ICU beds available. Statewide, throughout North Dakota, available adult ICU beds was at 23 and pediatric ICU beds at 5.
Has
Then
that statewide number gone down? Or gone up, in terms of available beds?
It has fluctuated. So I think last week that number was, for the adult ICU beds, was lower than that. So I think that's, increased a little bit. It's the pediatric ICU beds that seem to be more worrisome. And then the next slide shows statewide hospitalization data for North Dakota as of yesterday. There's currently 166 hospitalized due to COVID, with 23 in the ICU. So this is a little bit of an increase from last week at this time. The chart in the middle shows current hospitalizations broken down by age. Currently, there are 3 pediatric admissions due to COVID. And the chart on the right shows the age of, the age groups of total admissions throughout the pandemic. And the next slide is the updated graphic from the Sanford healthcare system as of November 23rd. Again, seeing the same trends week after week after week. The red people represent those that are not vaccinated, and the white represent those that are. Overwhelming majority of cases that are hospitalized continue to be among the unvaccinated. So 48 of the 51 patients on ventilators are not vaccinated. And then breakthrough cases, the updated data provided by the Minnesota Department of Health. Again, still continuing to see very small percentages of breakthrough cases in Minnesota. So we're at 2.855% of those that are fully vaccinated that have wound up testing positive for COVID. Breakthrough hospitalizations at 0.12% and deaths at 0.02%. That's all I have.
Morning. So the next slide, the statewide vaccine data for 11/23/21 for those 5 years of age and over. The individuals with at least 1 dose is at 69.7% statewide, and it was 69.0% last week. And then those that have completed the series, 64.2%, and it was 64.1% last week. So those first and second doses are crawling. I did just take a peek at the map last night to look, and across our area we're like 54% for Clay County, and pretty much within 50 to 57% around us. So we're all in that kind of same area. And then looking at the total third doses and booster doses, 932,115, and last week we were at 816,163, so a lot of the energy is going into those booster doses. Looking at those 5 to 11, 21% have had that first dose, still 0 for the second dose. 16% is what we saw in that age group last week. So. And then I'll just flip over to the next slide, which is the number of doses administered by Clay County Public Health. So for last week, we hit 17,512 doses, 246 last dose. So we're seeing a decline in the doses administered. And we have a breakdown of, that was the Pfizer and Moderna. We didn't have Johnson & Johnson last week for the first time. 16 doses were given for that 5 to 11 age group. 218 were booster doses, 7 were first doses, 5 were second doses. We continue to offer first and second doses, but we just have a few here and there, but continue to offer those. But the majority of what we were administering this last week were the booster doses. And then for this week, our clinics are planned. We just had the one clinic on Tuesday. It was a full day and into the evening.
last week because of Thanksgiving, but we're having 3 clinics this week. So we have today, we have a clinic at MSUM from 10 o'clock to 1 o'clock, offering Pfizer first, second doses and booster doses, and Moderna first and second doses and booster doses. Then back in the Family Service Center from 2 to 6 p.m., Moderna first and second doses and booster doses, Pfizer first and second doses for 12 and over, booster doses for 18 years and older. And then on Wednesday, we have a clinic from 2:30 to 5:30 at the Family Service Center, offering Pfizer first doses for the 5 to 11-year-olds, Pfizer first and second for 12 and over, and booster doses for 18 and over as well. And then on Thursday, we have a clinic scheduled for 10 a.m. to 3 p.m., Moderna first and second doses and booster, Pfizer first and second doses for 12-year and older, and boosters for 18 and over. And those clinics are all posted on our website. And do you want me to?
Commissioner Mojo has a comment or question?
Yes, thank you. Boy, you're really doing serious work with those doses administered, especially if you look at last week being a holiday week. So thank you for that work. I did have a comment from a couple folks in the public. When people are bringing their 5 to 11-year-olds for those vaccine clinics, there's a little bit of a hesitancy just with timing, because having them in the middle of the week, if they for some reason have a reaction and then spike a fever and then they're keeping them home. So many people have exhausted a lot of sick days. So the comment was if there could be one on a Friday, because if there was an issue that came up, it's a convenience, I think, for some people.
Okay, and 2 weeks ago, we had a Friday, but we can do that again.
Right, thank you.
So then just looking at the testing activity, we are seeing a 10.83% positivity rate, which is a reduction from the 12.45% the previous week, so less of the positives being seen. That's the week of November 21st. Total people tested was the 607, and then you can see the breakdown for the North Dakota and Minnesota and the number of positives. And then we talked about the clinics are at the, of course, there are many opportunities for testing in the county, but for the Vault testing site, we have availability Monday through Thursday and then again on Sundays.
Oh, yes, Commissioner Gailey.
And looking at that vaccination data, you said Clay County is probably right around 54% with what we know of for
Right.
fully vaccinated individuals. And I understand that is lower again because we just added that 5, the
Five and
littles. What do we really need to get to percentage-wise to have a real impact in our area with vaccination?
Well, with the Delta variant, initially when the pandemic started, their goal was 70%. We have to get this herd immunity at 70%. Over the pandemic, because various strains and numbers of circulating viruses in the communities, so many of them raised that. 70% they didn't feel was adequate. To really develop a good herd immunity in the communities. So they really haven't set a hard and fast 80%, but they're kind of ramping up that we need to see a higher percentage of people vaccinated in order to get better herd immunity, in order to stop the community transmission. So although unofficially set, they raised that 70% to a higher level because of the variant strains. Now, unfortunately, as we see a new strain emerging in another country and potentially will be in the U.S., probably is in the U.S. currently, just hasn't been detected yet, that will be a concern as well. What's the percentage to get the number of people vaccinated to be able to, have better immunity? The big message is, again, as we've said every week, and some of you have repeated that, we need to get people vaccinated. That's that's the most important strategy to continue to fight any other variant strains and then this new Omicron strain. We need to get a higher percentage of people vaccinated. Will we hit 80%? You know, I'm not sure. As much as it's been pushed out, we've been pushing out the initial vaccines. Now it's like, don't wait to get your booster. Please get your booster. Everybody is eligible for that, as long as it's been 6 months from Moderna and Pfizer and 2 months from the J&J. So the message is we continually, we sound like a broken record, I know, but get your vaccines, get your vaccines. That's the best measure we have to fight against the virus, not only Delta, but again, any new strains, because it really circulates in the unvaccinated folks. And those are the hosts where this really replicates. So, yeah, so that's a long answer to maybe your short question, and maybe I didn't answer it all completely. If you have other questions, go ahead. And
No, you got it. I'm also wondering too, this last wave seems to be taking longer than some of the previous waves. I'm wondering if there's any chatter with the state EPIs or others about why specifically they're thinking this wave is lasting longer.
You know, I don't think anybody knows for sure. We didn't expect it to last this long. There was statistical modeling that was done, you know, prior to the fall surge, and it was looking like we would have a very sharp increase of cases followed by, you know, a sharp decrease in cases like we've seen in other waves, and that's just not happening. And I don't think anyone knows for sure why. The hard thing is that we're trying to predict not only what the virus is doing, but also human behavior, and trying to add those two together and predict, you know, what's going to happen is a huge, huge challenge. I wish I had an answer.
One last thing then. Becky, you said that they're already starting work on if the boosters need to be adjusted at all with this new Omicron variant. I have an appointment to get my booster this week, so I'll be seeing you guys in a couple days for that. Encourage others to get boosted too if you're due for that. So if I get my booster this week and then let's say they do tweak something, can I then just come right back in and get that new updated one, or would it be another 6-month wait, or what's
You know, I think that's
speculation?
to be determined. You know, researchers have thrown out different timelines, and the estimate is it would take 4 to 6 weeks to get another vaccine ramped up. But again, that's we don't know for sure.
Thanks.
I want to do a follow-up to her first question, to Commissioner Cayley's first question. It deals with herd immunity. And Becky, as an epidemiologist, I said that right, didn't I?
Yes.
I don't think I could spell it. The closer we get to herd immunity, does that help reduce the chances of viruses mutating to what we currently have, for example, with this new one now?
Yes, absolutely. Yeah, the more that the virus is able to circulate, especially in people that are not vaccinated, the virus is replicating more and for longer in people that have no antibodies.
And can you explain why? Because it needs to have a living organism, right?
Correct. Yes, the virus does not live on inanimate objects. It actually breaks into our own cells and takes over our cells. So it needs a human host to be able to replicate.
And someone vaccinated helps.
Right, because they have antibodies, and you know, and that's also true of people that have had previous infection to some extent, although they don't have an antibody response as long as people that are vaccinated, which is what is being shown. But you know, people are infected with the virus, and it takes some time for your body to recognize that. But if you have those antibodies already there, it's less time, you know, for the virus to circulate in your body before, you know, our immune systems essentially attack it and neutralize it. That makes sense.
Well, it does. I've asked that same question in multiple different ways, but I'm trying to.
The immune system is very, very complex. It's
Well,
hard
but
to-
it's also, I think it's, I continue to try to help people understand why there's additional significant reasons to get vaccinated. Because we all are constantly asking the question, when is this ever going to end? And if that thing can keep mutating, and keep mutating, this will never end.
And that's why, public health has pushed so hard to get people vaccinated. It is really a race against the clock, because the longer this goes on, the more virus that can circulate throughout the communities and unvaccinated people. It's prolonging the pandemic, and prolonging when we can officially say it's at that endemic stage.
Thank you. Yes, Commissioner Ebinger.
Yeah, I just, we can't belabor this enough to try and get the point across, but I was talking to Kathy before the meeting, and I'm kind of a get up at 5 a.m. news person, and I know there's not data in on Omicron sufficient to where you can specifically say things, but I read this morning about a small study done in Israel and some of the results that are coming in from South Africa, and it does reinforce what we already know about Delta, is that even if there's a reduced efficacy of the immunizations to keep you from becoming infected, there is still a much heightened chance that you aren't going to die if you've had immunization. You're not going to have serious consequences out of this. It's going to be about with something similar to the flu, which you still have to be careful because you need to go and isolate yourself and deal with that and not spread it. But, just to belabor the thing we're trying to get through to people is that we're already hearing, well, you see all these variants that the immunization doesn't work. Well, yeah, it works better than the flu immunizations do, and it keeps you from dying. And I just think that can't be stressed enough. People really need to just take a breath. This is a health decision, not a political decision. And go get your immunizations. And go get your boosters if you've already had your shot. And if the future boosters are going to address variants specifically, don't wait. Get your booster now, because you don't want to incubate a new variant. You don't want to be the initiator of this. There'll be chance to get an enhanced booster somewhere down the road. But I know you guys keep saying it, I just want to give an amen to it. And what little bit of data is coming out has not changed the fact that this will keep it from being severe.
Yep.
All right. Any more questions? Any more comments? Thank you.
All right, thank you.
Next week?
Next week, there is no meeting, is that correct?
Oh, yes, you won't see us next week. You'll see us in 2 weeks.
We could show up, but,
Will you still
Yeah.
put the data on the website?
yes,
So we can,
absolutely.
thank
Yep.
you.
And maybe if you can just kind of send each of us
Will do.
this by electronic so we
Yeah.
can look at it.
Thank you, get that sent. Thank you.
We need something to do during our off time. Yeah.